Good morning, everybody. My name is Anand Pillai, and I'm a consultant in Manchester. Like everybody else around the country and possibly now around the world, there is a crisis going on with the COVID-19 virus, and there are a lot of concerns regarding personal protective equipment for medical staff as well as for other care staff. This video is going to go through some aspects of mask wear and mask use. There are some concerns regarding the availability of PPE and the shortage of PPE, etc. For example, yesterday I was in the supermarket and I was walking around, and there were a number of people there who were actually doing their shopping, their grocery shopping, and they were wearing different kinds of masks. For example, this is the typical mask which a lot of people seem to be using and wearing. So this is just a simple paper mask. It goes across your face and attaches to your ears to give you a bit of protection, and it covers your face and mouth. And also around the hospital, when you walk around, you do find that a number of medical staff, including radiographers, nurses, and even surgeons and physicians are wearing these type of surgical masks. These are again surgical paper masks which are disposable. So you can see this is one that I was using earlier on today. So it just goes around your face and fastens around your head to hold things in place. But these paper masks do not actually provide the amount of protection you need for protection against the COVID virus. What you need for protection against COVID is is a mask which provides you at least 95% particulate filtration. The virus itself is spread by droplet infection and is by aerosol infection. So you need to have a mask which protects against at least 95% of all particulate matter. So how are masks classified? I think it's quite important to know something about it. There are two ways to classify masks. One is the FFP3 system, which is the European system, and then you have the American system, which looks at the N grading. So they are generally FFP1 or a N1 mask, which gives you 90% protection against particulate matter. Then there's FFP2 or N95, which gives you at least 95% protection. And then you have the Holy Grail, which would be the FFP3 or the N99, which protects against 99.9% of particles, which is probably the best mask you can get. I have an example here for you for a FFP2 mask. This is a face mask. You can see very clearly here that is written that it is an FFP2 mask. So this would confirm to what would be an N95 mask. So that will protect against the COVID virus. If you were to use a mask, probably you should be at least using a face mask such as this. But ideally, if you have what most hospitals are providing their employees and healthcare workers is a FFP3 mask. As you can see here very clearly, a certain FFP3 which protects against 99% of particulate matter. This is probably the best mask you can get. And the FFP3 mask, because they do confer better protection, sometimes comes with a inner lining which gives you a better fit against your face. And also, like this particular mask has got a 3M proprietary valve, which ensures that the mask can be wear for longer, doesn't get moist and doesn't get soggy, and is more comfortable to wear. But the problem with these masks is that they are only as useful as they can form a tight seal against your face. So if you're not clean shaven, or if you haven't shaved in the last 6 hours or so, or if you have a small stubble, or if you have a beard, or like some individuals might have long faces, short faces, these masks may not fit. So before you use these masks, it's important that you have a proper fit test to confirm that the mask do work, and if a particular mask works, then you do only use that particular mask. Like this one here is the one which is tested for me. It goes on that way with the straps against your head, and it will provide you with a seal which will keep your mask in place. But there is a shortage of these kind of masks, and I think that if the crisis is going to be longer lasting, we might at some point struggle to protect all the staff and all the patients with the adequate level of protection that we need. And these are all single use, and ideally when you come out of a clinical situation or after seeing a patient who is suspected to have COVID or has been proven to have COVID, then you probably should be changing your mask so that you don't infect people around you or other patients or yourself for that matter. And it's pretty important how you handle the mask not by touching the outside surface, especially if you've been in contact with a patient with COVID, because then your hands will get contaminated, and you would need to wash your hands or gel them to ensure that that is safe. This kind of led us to have a little think about what other options might be available with regards to face protection. And one of the issues I had with the FFP3 mask is that although it fits quite well and it passed the fit test, I wear spectacles and I was struggling to wear my glasses on top of this mask. And it's quite also important to know that you also need to have your eyes protected at the same time as wearing any mask. So there are individuals who might not be able to see very well without glasses, so they might again struggle to actually fit the glasses on top of the mask. But again, the glasses need to be sealed, so you should be using surgical goggles or a face shield which needs to come to your neck, or full face, rather than just your normal glasses, because the glasses will not confer inner protection. This got us to thinking regarding what can we do outside the box in case there was a situation where no FFP3 was available, or we did not have even access to N95 mask or an FFP2 mask. If we had to deal with patients, or if there was an absolute pandemic or situation where we had to improvise. So we came up with an idea of trying to use a scuba mask. And I must credit one of the anesthetists who actually thought about this. But what in this video we're going to show you is an adaptation of how to use the scuba mask with a filter which will provide you some protection. So what we have here is a standard scuba mask from one of the sports shops. You can see that there's a new mask. It's not been opened. So I'm just going to open the mask here. So straight away you can see that it comes in two pieces. That's the mask, and you have the snorkel. The snorkel would normally fit in at the very top. It simply clicks in to actually work as a snorkel in case you were diving or swimming on your holidays. Unfortunately, this video is not about swimming or your holidays. So the snorkel in this case is actually taken apart and kept aside because we won't be using it. So that is a scuba mask, and the good thing about a scuba mask is that it's got a fairly robust strap which goes over your head to hold the mask in place. And it does one more thing. Once a mask is in place, you can know whether or not you have a proper fit by simply closing the air hole which is on top. So if you're not able to breathe, that means that you got a tight seal. So like here, I'm going to put the mask on so that you can see what I'm going to do. So that's me with the mask on. I'm sorry for being muffled. And you can see that if I close the air hole on top, and I was struggling to breathe. So this mask fits me, and that is the correct size for me. Actually, it's one size smaller than I would have otherwise bought if I was actually going snorkeling. And compared to the disposable face mask, where the seal is really important, and the seal can occasionally be broken if you are talking too much or moving, which might actually expose you to the virus. This, because the way it's held with straps behind your head, and also provides you full face protection with a visor, it's possibly slightly more safer if you're able to attach a particulate filter to this. That's what the second part of this video is about. So what you need for this is a rubber snorkel mouthpiece. So if you had a half mask snorkeling gear, you would buy one of these mouthpieces so that you use that as your snorkel. So you need one of these, a cup of hot water, a couple of cable ties which you might find in any orthopedic department or in your hardware store, and a pair of scissors. What you also need is a couple of anesthetic filters. I have one here to show you. This is a intersurgical filter, and this is normally used in the hospitals with the respirators, anesthetic machines, as an oxygen filter. There are various types of this. This particular one is a heat exchange and filtering device. So this provides you 95% filtration, and if you have more robust filters like this one here, which is a HydroGuard Mini, which provides you 99% filtration. So there are various filters which are available, but you at least need something which provides you 95% filtration. If you're unsure about the filter you're using, if you go to the manufacturer's website, it'll tell you how much filtration that particular filter provides. So how do we do this? So what we're going to do here is I'm going to remove the mouthpiece from the snorkel. As you can see, this is made of really soft silicone because it's meant to be bitten and kept in place. So I'm now going to dip this soft silicone mouthpiece into a little bit of hot water for a couple of minutes. It does two things. One is that it softens the silicone a little bit, and also it provides a little bit of lubrication. Obviously, you don't want this to be boiling water and to damage the silicone, or you really don't want to misshape it, but you just want to make it a little bit more pliable and flexible. Once you're done that, what you need to do is insert the mouthpiece into the air inlet of the snorkel. It should be a tight fit, so you should not be able to get it in easily, and there should be a small amount of struggle to place it in place. Like here, hold it with one hand and you pull on the other and you insert it. You can see now we have the mouthpiece fully inserted into the snorkel, into the air inlet. The way to check it is you put the mask back on, and you close the inlet. And you should be able to get that seal. How do you secure it? It's quite easy. Get a cable tie. It goes over the area where you've actually secured your mouthpiece. Simply tighten it. You pull it tight and you clip it off. It'll ensure any accidental dislodgement of the mouthpiece from the air inlet on the scuba mask. Once you've done that, there are various ways to connect the filters on. You can simply attach them if you want, using one of the connectors to the air inlet, and once the connector is inserted, the filters can be put onto it with some ease. Alternatively, you can use the larger filter. Again, it goes on without any difficulty. So you can see what the finished product looks like. And you can check the seal once more. There are various modifications of this, because you can put an elbow connector, and you can have the filter facing backwards, because that might provide you better protection rather than having the filter facing forwards. Like in this example, that's an elbow connector, which again comes with the filter, so you can have it connected backwards. For example, if you're forward facing the patient, you would like to have the filter facing backwards, which would make more sense because you're not taking air from the front.
There you go, that's the finished product. And you can see I have a perfect seal.
One of the problems with this mask is that obviously talking through it is a bit difficult. The voice is a bit muffled, and you need to ensure that if you are using something like this, is that the connector is fairly secure, and the connection between the mouthpiece and the filter is also fairly secure. And the way to do that would be using cable ties if necessary. Now, I must admit that this is not what we would advise that anyone uses. This is a DIY or a self-made mask. Ideally, you should be using what your employer or your trust or your hospital provides, which should be a fit-tested PP3, FFP3 mask, or a N99 or at least N95 mask. So this is just potentially something if you had to, if you're in a situation where you have no access to anything at all, or if you are in a country or a location in the world where there's no access to some of these devices, or if the pandemic extends beyond a period that it tests all our resilience, is that something that you could potentially resort to as a last resort. So this is not an alternative for normal fit tested PPE, which we all should have and we should be using, protecting ourselves and our patients. But this is just an alternative which I thought was quite useful to put out there if anybody did want to actually make their own mask, or they've got no access to it, or if you are in a slightly underdeveloped situation or a country, and there are challenges in obtaining what essentially is appropriate PPE, because the whole world at this point is looking for them and clamoring for them. And the good thing about this mask is that it's washable. So this is essentially a scuba mask. It's designed to go underwater, so it's waterproof compared to the disposable FFP3 views. Obviously that can't be used or cleaned. It's not possible. So this, obviously the filter would need to be replaced and thrown away, because that has got a paper or a cardboard element in it that would need to be disposed. But the rest of the mask, you can soak it in water, you can wash it with soap. A light bleach solution will actually do your cleaning for you. Or you can use a chlorhexidine wipe and wipe it down between uses, which you should do, which does protect the mask. And because it's designed to be used in salt water and underwater, it's fairly resilient and it doesn't degrade very quickly. Thank you everybody for listening, and can I please request all of you to stay safe and look after yourself and your patients and your loved ones. And I hope that I'll see you all on the other side. Thank you.